All right, so I want to welcome you all. I do see a lot of familiar faces and a few new people. So I'm Brian Schiffman, President and CEO of the Vaughan Chamber of Commerce. It's good to welcome you all here today. I see Belinda. I want to give a special shout out to you. How's it going? And what we did was proactively, we muted everyone when you've come on, just so we can focus in on the speakers. There's no background sound. I do encourage you, though, to use the chat box throughout when you have questions for one of the speakers. They're each going to talk for 5 to 10 minutes at the close to the beginning of this session. And then we're going to take your questions from the chat. And what I'll do at that point is my team's going to be directing me behind the scenes, and they'll say, okay, Nelson, it's your turn, and I'll come to Nelson, and you can ask your question, and please direct it. There's 3 speakers, so please let us know who it's directed at. I wanted to some housekeeping notes, just a little bit of context for this. So thank the City of Vaughan, their Economic Development Department, for their support on these sessions. And also for those who are new to the Chamber, Chambers really do two primary functions. One is the one we all think of, which is selling and marketing, business leads, networking. So the Chamber pivoted a lot of our operations at the beginning of COVID to ensure that businesses could still do aspects of that through our weekly networking sessions. We've actually seen a lot of deals go through there, as well as our Facebook Marketplace, which we've made free to the whole community. We're closing in on 200 members on there just for Facebook Marketplace. So I'd encourage you to use those. For those like Enzo and Rose, who I see on here, who are on every Friday on our networking sessions, I mean, I know you guys are big endorsers of it, so I do encourage people to continue to network and make business connections during COVID. Look, everybody's in front of their computer screen all the time, so it's a great time to send LinkedIn invitations, among other things. Now let's talk about the other big thing Chambers do, which is policy and advocacy. At the outset of the closure of business mid-March, there have been a number of government programs rolled out, as you're aware of, like the wage subsidy, the business support for commercial rent. The Chamber's been very involved in these programs, trying to get revisions to them, such as with the wage subsidy, which did happen. We continue to be involved. We spoke to 500 of our members right at the outset, asking you what your concerns were. We've been advocating with government at all levels every single day, and I see some of our policy people on this call as well. So we'll continue to do that. And whereas at the beginning, the conversation was typically about cash flow and liquidity, and then a lot of discussion about what do I do with my employees, and then a lot of discussion about the rental program. Now it is about sessions like today, which is how do I return my workplace back to some level of normal and ensure that it's safe for both my employees and my customers. So we're doing now a lot of programming like this to try and give you examples of how business and government is advising you how you can reopen safely. Last point is, for those who have seen, we have done a series of business seminars online and virtual town halls with the Minister of Education, the Minister of Seniors, 2 chief economists, employment lawyers, accountants. There have been 5,000 views of those and 600,000 in terms of engagement. So if you haven't tuned in for those, I encourage you to do so. All these resources are, I think, just one extra piece of the puzzle to try and provide some assurance to business in a really confusing time. How do I use these programs? How do I get back to work safely? So without further ado, as a reminder again, please stay on mute. Submit your questions in the chat. We will get to those. I want to thank and introduce our 3 speakers. We have Dr. Leon Genesove from York Region Public Health. I'm going to do their bios now. He's a public health physician with York Region Public Health, and he's been very active supporting the COVID-19 response. We have Bill Chen, a regional community coordinator with Workplace Safety and Prevention Services. His job is to reach out to small businesses and community organizations across the GTA and provide free resources in health and safety. Bill also volunteers with WSPS to deliver health and safety presentations to co-op students and newcomers in the GTA. And we also have Stuart Rudner. Stuart is a longtime member of the Vaughan Chamber of Commerce, very active with us, a leading employment lawyer in the GTA, and the founder of Rudner Law. Obviously, he'll be able to answer some of your employment law related questions. So welcome to all of you. And I think we're going to go to Dr. Genesove first for a presentation.
Thank you very much, Brian. So I'm Vaughan Chamber. I'm a physician with York Region Public Health, and thank you very much for inviting me to participate today. So I'm going to be reviewing during my few moments here how to incorporate public health principles into your business continuity plans. So what's important in terms of those public health principles to keep your business open, keep your workforce safe, and keep your customers and consumers safe. So I'm going to just give a brief review of COVID, a little bit in terms of transmission, and then focus on preventing the spread of COVID in the workplace based on public health principles. So just a reminder to people that about the transmission of COVID-19, it's through prolonged close contact with symptomatic cases of COVID-19 that's causing the majority of transmission. However, we do have some people with only mild COVID-19 symptoms, especially at the early stage of the disease, and they can still transmit to other people. So the transmission is through technically what we call droplet transmission and surface contact through contaminated surfaces. So in York Region, we've posted on our website a lot of information for you to help you with your business continuity plans. So you can look at york.ca COVID-19 has a toolkit for businesses to help you. Our website is also updated daily at 5 p.m. with up-to-date case information, including a breakdown by municipality. And we also have a dashboard now with information on workplace clusters that have been confirmed in York Region. And we're defining workplace clusters as 2 or more cases in a workplace that are likely to occur as a result of workplace transmission or acquisition. So currently in York Region, there's 22 confirmed active clusters, 19 of which unfortunately are in Vaughan. So there's a lot of posted information from the various governments on guidance for preventing COVID-19, and they're updated frequently, so you want to have a look at those frequently. So whether it's the york.ca website, the Ontario government's website, or my colleague Bill and Lori will talk about the WSPS websites. I think it's important to remember that all these guidance materials are minimum standards. And I think you have to look at also implementing best practices in your particular workplace. Now, why are we looking at public health principles and why am I reviewing this? Well, there's no medical treatment we know for COVID-19, specific medical treatment, and there's no vaccine prevention yet. So therefore, we have to rely on public health principles. And the 4 major principles that I'm going to go through in the next few minutes are health protection practices, physical distancing, environmental cleaning and decontamination, and then case-based public health interventions. So it's important as you plan to open up that you plan ahead of time and rehearse and ensure that you have smooth logistics in place for all these public health principles. So let me review first the health protection practices, the first principle. So it's important to inform your workplace of what your plans are and post details online into social media so that your customers or consumers, if you have, are aware of what your plans are. And some of the basic principles, of course, workers must stay home if sick. You're going to want to also, as you open up, or if you open now, implement pre-shift screening health checks for workers to complete either at home or before workplace entry. And of course, if any workers are sick or any individuals are sick with COVID-19 symptoms, then they should be self-isolating at home if they have symptoms or if they are an exposure to a COVID-19 case. And again, as we see with everybody on Zoom here, we want to encourage people working at home where possible. At your physical workplaces, it's really important to emphasize regular hand washing or use of hand sanitizer. So some workplaces will actually implement regular hand hygiene and surface cleaning breaks during the day to ensure that people are implementing proper hand hygiene and keeping the work areas safe. And then you want to provide hand sanitizer at your workplace entrance and at other locations in the workplace. Again, also the usual advice on respiratory etiquette for workers and consumers, putting up signage in the workplace, both for your workers and customers. And the message also from the provincial government now is pretty much that testing's opened up for anybody. So go get tested if you're worried about COVID-19 symptoms or exposure to the virus. So that's another public health principle that's important, is that our testing is pretty much open now for everyone. And in York Region, of course, we have the 3 assessment centers available for folks. Other principles are well known: avoiding close contact by physical distancing, so keeping staff and customers at least 2 meters apart. And I'll talk a little bit more about that in another couple of minutes. And then wearing a mask when physical distancing cannot be maintained. So either a cloth mask or single-use non-medical masks. Also, eye protection and face shields is going to be, or face shields will be important in many situations. And then gloves, if it's appropriate for use in the particular workforce. So glove use isn't necessary or recommended in many situations because of the concern about cross-contamination and self-contamination. So you have to take a close look at whether gloves are appropriate for the workplace. It is important, though, to ensure that for your personal protective equipment, that you have sufficient PPE inventory and a secure supply chain. You also want to review the ventilation in your workplace, and where possible, increase the ventilation or increase the fresh air intake where possible. Also, if you're just opening up your building, reviewing water systems if you're starting up after a prolonged shutdown. So you want to prevent the occurrence of Legionella contamination, either in the drinking water or in the cooling towers in the workplace, if there are. As I mentioned, it's important to communicate with and train your workers and engage with them in workplace safety. And workers really have to understand how COVID is transmitted to be able to be compliant with the safety measures that have to be implemented. You have to have a plan to manage workers who become ill at work. So sometimes somebody's going to become sick at work, potentially with COVID symptoms, and you have to have a plan about how to manage them. And also workers have to be aware of your sick leave policies and how to call in sick. So there are cases that I've dealt with that people don't seem to be aware of this. So it's important to ensure that your workers are aware of this information. If there is a COVID-19 case reported in your workplace, you'll be working closely with and collaborating with public health in York Region to have the worker identify their close contacts and to ensure that appropriate isolation is being followed. You also want to consider notification to your workforce, and in some cases to the public. In terms of the public, it's up to you. I highly recommend it if you have a very strong public consumer base. Certainly, notification to your workforce is going to be key also in terms of COVID-19 cases in the workplace. And then potentially providing assistance to support mental health workers. Mental health for the workforce is going to be important. That's an increasing area of concern. I just want to talk briefly about return to work for individuals that have tested positive. So any individuals and workers that have tested positive must self-isolate for a full 14 days from symptom onset or 14 days from the positive test collection date if they've never had symptoms. And they may discontinue isolation after the full 14 days have elapsed, provided they have not had fever or symptoms for at least 72 hours afterwards. Clearance testing is not required and is not recommended. I'm going to talk a little bit now about physical distancing. So one of the first problems we've come across in York Region relates to carpooling to work. So you have 5 or 6 people that are neighbors, potentially not the same household. They're carpooling one car to 2 or 3 different workplaces, and we've had episodes of COVID transmission due to carpooling. So you have to talk to your workers, discuss them with that, and look at what the alternatives are. When people are taking public transit, if they're taking public transit, it's important also that we want to encourage workers to use cloth masks when they're taking public transit, which we've seen in Toronto and York Region is going to be mandated pretty soon. We also have on our website guides to health and safety during carpooling. You want to put on occupancy limits in your workplace. No specific recommendations yet about occupancy in workplaces, but as you know, the province issued guidelines for places of worship recommending 30% of usual occupancy in houses of worship. Other ways of controlling physical distancing is modifying work hours, shift staggering, It's important to control the traffic flow into and out of workplaces. That's often where bottlenecks are. Modifying workstations to promote physical distancing, either through physical barriers, signage, potentially looking at one-way hallways and stairs, and modifying any eating areas or rest areas with physical distancing and or barriers, and limiting occupancy. You also want to modify public areas with the customer interface, which we've seen quite a bit if you've gone into the restaurants and coffee shops. So transparent plastic barriers at customer service counters, physical barriers to keep the customers 2 meters apart, signage and floor markings, other ways of delivery like curbside pickup, which is implemented in a lot of places. And then in larger workplaces, you should consider having a physical distancing coach, especially at congested areas and busy areas. And then there's many other possibilities to engineer physical distancing depending on your workplace. Then that third principle I mentioned is environmental cleaning and decontamination. So Health Canada has a website on approved products for cleaning and decontamination. If things go well, I'll try and put all those links into the chat box after I speak. But frequent cleaning and decontamination of the workplace is extremely important. So it depends on the nature of the work. So definitely at least once a day, and then potentially several times per shift if there's heavy activity or possible COVID contamination. The fourth principle is case-based public health interventions. And for your workplaces, you'll be partnering with public health. Public health in York Region is involved in case management and contact tracing, and we'll be working closely with you. And we have a health protection division also that does workplace inspections, and they'll be engaged with many workplaces also. So I think I will, so just finally again, the role of public health units and public health in York Region. The main roles in terms of partnering with you as relates to case and contact management, as I mentioned, outbreak management, assisting with the assessment centers, and physical distancing measures. And these are some of the areas that are key strategies and that we'll be working with you on. So those are my remarks for now. Thank you very much.
Thank you very much, Doctor. I have a whole series of questions I thought of during that, but we'll save those for after, and we'll see what others want to ask as well. Certainly one thing that struck me immediately was the comment about carpooling and making sure you're talking to those you're carpooling with to work just to reduce the spread. Belinda from Hospice Vaughan, good friend of the chamber. It's funny, first of all, I appreciate the comment you put thanking healthcare workers. And then I saw your note about where do you get PPE, which was a good question now because I wanted to mention that on the chamber's website, you go on the homepage under news, and then under news, there is a PPE guide that all 9 chambers in York Region put together. This is not an exhaustive list, but there are a lot of companies on there that sell all types of PPE, from hand sanitizer to plexiglass, face shields, special equipment, etc. I know that the Vaughan specific section, when you look at it, has, last time I checked, had 16 companies. No guarantee they'll always have the supplies right now, but those are companies we're aware of. So that's one resource you can use. Okay, so let's move to Bill Chen. Again, Regional Community Coordinator for Workplace Safety and Prevention Services. Hi, Bill.
Thank you, Brian. Thank you, Doctor. Jennifer, can you see my screen now?
Yes, we can see your screen, Bill. Okay,
great. So I'm pleased to make a presentation about our resources for small business and related to COVID-19. And so the title is Safety Insight for Getting Back to Business During COVID-19. First, a disclaimer. So this PowerPoint, this session is for information purpose only, and it is not intended to provide advice to any specific industry or workplace. It is not a technical consulting as well. And we hope to make the information as current as what we can. And if you have any specific COVID-19 questions, you can always go to our website. I will give you the website and a lot of useful links later as a follow-up. Workplace Safety and Prevention Services, WSPS. So we are a not-for-profit health and safety association. We are part of Ontario's health and safety system. And we offer health and safety expertise, consulting, training, and a lot of free resources to our customers. During COVID-19 pandemic, we partner with Ontario government and the Ministry of Labour, Training and Skills Development, and create a lot of sector-specific health and safety guidance documents for different sectors. And you can find all those documents in our website. And for me, I'm with the small business team. And my job is to provide free health and safety resources, either to small business directly or through working with business groups like Board of Trade, Chamber of Commerce, or business associations. And if you need more information about our COVID-19 resources, you can go to our microsite. I list the homepage here. And our vision is every worker healthy and safe every day. And I hope to work with you to bring health and safety to more businesses in Ontario. And now I know that many businesses are reopening or planning to reopening. And that is why we were working with Lear and created this pandemic handbook. It is a how-to build, it is a how-to guide for getting business in Ontario back to work safely, although it is not a one-size-fits-all approach. We want to provide a playbook so you don't need to start from scratch. And this playbook includes practical guidance from the Ministry of Labour, Training and Skills Development, Health Canada, and Public Health Ontario. And most important is that it can be tailored to meet your specific needs because no one knows your workplace better than yourself. And for this playbook, we include a lot of useful resources like employer responsibilities during pandemic, hierarchy of control measures, health screening for your workers or for your customers, isolation practicals for your workers, self-isolation and returning to workplace protocol, physical distancing protocol, and training and communication to spread all the message to your workers. And here we also have some checklist. During the pandemic, most businesses fell in 3 categories, and their operations are quite different. The first category is those essential businesses who were still operating during pandemic, like transportation, food manufacturing, grocery stores. The second category is those businesses working at home. Many professional services are in this category, and we are also one of them. And the third is those completely shut down during this pandemic, like restaurants, shopping malls. And for all 3 categories of businesses, we have created a checklist to support them as they are reopening. And these checklists are supposed to be used as self-assessment to assist you in ramping back up to regular business operations. That's why you see that we have 3 checklists for different categories. And health and safety guidance document. As I said just now, we are part of the health and safety system. And we help the Ministry of Labour, Training and Skills Development and the Ontario government and create a lot of, I think, more than 90 health and safety guidance documents for different sectors. These documents outline safety measures that the businesses should follow up so they can be reopened safely for workers, customers, and the general public. And I know that many small businesses are struggling with health and safety because they don't have enough resources. That is why we have this small business center for business under 50 people. And you can see that we divided small business into 3 groups, 1 to 5, 6 to 19, and 20 to 49. And that is according to the definition of Occupational Health and Safety Act. And for different sizes of workplaces, they have different requirements in health and safety. And if you click on the link for the size of your company, the information that is presented will be tailored for your requirement. And also in this small business center, we also have a link to our COVID-19 resources center. And here you see, I have a page open for a typical small business from 6 to 19. First is the safety checklist. So it is a self-evaluation checklist that you use to assess the situation of the health and safety in your small business. And we also have other resources like duties and the responsibilities for employers, supervisor, or workers. And we also have a health and safety policy as a template. You can just copy and paste and insert your company name and sign and date it. We also have a list of the posting requirement. And we have violence and harassment policies programs so you can download and for the training and the communication in your workplace. And then the law also says that if you are a small business between 6 to 19, you need a health and safety representative. And this representative must do something like inspection, investigation, or reporting. So we also list something related to this position. And also you can find other resources like hazard assessment in the workplace, training orientation, first aid, injury report, or return to work. And if you still need more resources or help from us, here we have a free consulting program for small business below 20 people. Because as the law says that if you hire more than 20, you need a joint health and safety committee, and there must be at least 2 members in the committee. And these 2 members must be trained and certified. So they should be pretty good in health and safety. But for small business below 20 people, they just have 1 health and safety representative. And now, according to the law, there is no mandatory training requirement for these people. So that's why we have this free consulting program. And this program is free for all participants who are selected. Health and safety expert, they are all Canadian registered safety professional. They will help you and they will work through your workplace and they will sit down with you either to build up your health and safety system or to improve your health and safety system. And I know that some customers, they receive orders from Ministry of Labor inspectors, and they use this free consulting program to finish the requirement of an order issued by inspectors. And we also have a program handbook with practical tools for this program. And some company ask that they are sole proprietorship company. Are they still eligible? Yes, even you are only 1 person, you are still eligible for this small business advisory service. And now under pandemic situation, we have a duty consultant team. They are working from Monday to Friday, and their time extended from 7 a.m. to 7 p.m. Here is their contact information. And if you need more free resources from my team, you can always contact me. And here is my telephone number and my email address. And finally, let me share something about, okay. Here is, you see here is the post-pandemic business playbook with a lot of resources you can use, and you don't need to start from scratch. And we have if you are in restaurant sector, as you know, we moved a lot of resources online and we cancel a lot of face-to-face meeting, but we have a lot of webinars. On June 25th, from 10:30 to 12, we will have a free webinar about health and safety specific for restaurant to help them reopening. Here is more information about this. Okay, I think that is pretty much about our resources. And after the presentation, I will send out a follow-up email to Jennifer with all the list of the resources we have and the information. Okay, thank you.
That's great, Bill. Thank you very much. And I see a lot of questions being asked, and I know one of your team members is on here as well, and she's been posting, so we appreciate that.
Thank you, Brian.
Thank you. So let's go to Stuart Rudner from Rudner Law now.
Great, thanks, Brian. And I'm just going to try to share my screen, which hopefully I'll get set up. Here we go. Can you guys see my screen? All right, thanks for the nod, Jennifer. I appreciate that. Thanks for inviting me to be part of this. It's kind of nice to see a bunch of familiar names and faces on the list. And Brian, as you said at the beginning, I'm happy we're in this new phase. I mean, I spent about 8 or 9 weeks, felt like all we talked about 24/7 was layoffs and wage cuts and hour cuts, and now we're finally talking about recalling people back to work and safety in the workplace and getting back to business, which is great. One thing I do want to talk about, though, is when this all started, of course, everybody had to scramble. We were all reacting to these completely unexpected circumstances. Frankly, a lot of mistakes were made because people were acting very quickly. This transition to back to work is going to be a lot slower. We all know that, which should mean that people have time to prepare. And I'm hoping that people are going to make more strategic decisions. My concern is I'm already seeing situations where people are not, where people are making mistakes. Or employers, a lot of our employer clients or other people are actually underestimating their own rights. And a perfect example is a lot of employers that I'm talking to are letting their workers dictate terms. You know, the workers that are being recalled, they refuse to come back, or they're insisting upon certain terms to come back, or they're not going to come back until July. And in most cases, the employee doesn't have that right, and yet the employer is convinced that there's nothing they can do about it. So my biggest focus, and this has always been the case, is on education. I want people to understand what their rights are, what they're entitled to do and not entitled to do, and basically make smart decisions as opposed to acting based upon assumptions, which either leads you to liability or, like I said, in many cases, I'm seeing people spend more money than they need to. So I do want to mention at the beginning, we spent a lot of time, my team and I, putting together a guide to getting back to business. It's about 30 pages long. And obviously goes into a lot more detail than I can in the next 5 or 10 minutes. So I'm happy to share that, and I'll be Jennifer, the best thing is I'll send an email with the link, or anybody can feel free to reach out to me, email me. I'm happy to share you the guide, and obviously happy to chat with you as well if you have questions as you're planning to your return to business. So let me go through a few key points. Actually, first of all, I'm glad I'm not the only one doing a disclaimer, but I will repeat essentially the same point Bill made, which is this is for information purposes only. It's not intended to be legal advice. Every case is fact specific, so please do get the advice you need before you make decisions. But also the timing. Things have changed so rapidly over the last 12 or 13 weeks that even presentations that my team did 3 or 4 weeks ago, a lot of the information isn't quite right anymore because things have changed. So be very careful about relying upon this information as you go forward. And please, feel free to reach out to us before you make decisions. It's always cheaper to prevent a problem than it is to fix it later on. So first thing I want to talk about, what's new? So today's Friday, so 2 weeks ago, the Ontario government, very late on a Friday afternoon, very quietly released Regulation 228/20, which prompted a whole lot of Twitter debate amongst my employment law colleagues over the weekend as to what this meant. Most of it was good news for employers. A lot of you, I'm sure, were worried about the 13-week limit on temporary layoffs, which we were starting to come up upon in many cases. So like many provinces, Ontario took action to address this concern. What they did, and as the slide explains, they basically took all of these layoffs that had taken place, as well as reductions in hours and reductions in pay, and deemed them to be emergency leave. So retroactively changed it from a layoff to a leave of absence, which meant no more concern about hitting a 13-week limit or anything like that, which is great for employers. That being said, leaves of absence come along with some requirements. One is that benefits are generally supposed to continue, same way as if you have somebody on mat leave, for example. Now, they did carve out an exemption. So if you had already laid somebody off and had cut off their benefits, you weren't going to be penalized. So you don't have to continue the benefits, but otherwise you would have to. And here's the biggest twist. Because it's a leave of absence, as I'm sure most of the people on this call know, if you have somebody on a mat leave, at the end of their leave, they are entitled to be reinstated to their job. So the same thing should apply to these emergency leaves. And that's where it's going to get complicated, because I have a lot of clients who don't necessarily want everyone back, and we're going to have to work through that. Now, this doesn't all matter if the person was already let go and terminated already before May 29th. Otherwise, all this applies. And going forward, what the law says, or the regulation says, is if there's a reduction in pay, in hours, a layoff, essentially, it's not going to be deemed to be a layoff or a termination or a constructive dismissal under the Act. That doesn't mean you're out of the woods as far as potential common law constructive dismissal claims, which, and I'm not going to get into that now because we don't have time, but that's always an ongoing risk. What I do want to focus on is bring workers back. So here's where I see a lot of myths and assumptions being made. And everyone tells me about how they know that they've got to recall people based upon seniority, or that the first person laid off has to be the first person brought back. None of that is true unless you're unionized. If you're unionized, you've got a collective agreement that lays out very clear procedures for layoffs and for recalls. If you're like most employers in Canada, you're not unionized, there are no rules as to who you bring back and when. And you're entitled to think about who you want to bring back, think about what your business needs are, think about how you can bring people back safely. You may have to distance, which might mean fewer people being brought back, but you can pick and choose who you want based upon any criteria you choose, or no criteria, with the two exceptions I put on the screen here. So no human rights. You can't choose based upon race, age, ethnicity, or more importantly, COVID-19, which is being deemed to be a disability. So let's say somebody tested positive in March or April or May, you can't discriminate against them now by failing to bring them back. That would be a breach of human rights. Other than that, you're generally free to bring back whoever you want, whenever you want. And the question we often get is, can you bring them back but on reduced hours or pay? And it's risky, because anytime you make a substantial change to the terms of their employment, that could be a constructive dismissal. So definitely suggest getting advice before you do that. In many cases, it will work, and we've helped a lot of clients do this, but you want to do it properly, and by all means, get the agreement of the employee so you don't have to worry about a claim later on. Probably the most common question we're getting these days, what if somebody refuses? I've recalled my worker and they say no. They either are scared to go out in public, or and I don't want to be critical of individuals, but there are some people who have said, I'd rather just stay home for the summer and collect my CERB. Can we force the person to come back to work? The general answer is yes. And I think this is really important. People understand work is not an option. And if you think back to the pre-COVID days, which seems like a long time ago at this point, if somebody worked on Monday and Tuesday, they couldn't just decide not to go to work on Wednesday. It's no different if you've been laid off and now you've been recalled. You can't just decide not to. There's only 3 exceptions to this requirement. One is if you're on a leave of absence. So I talked about that a minute ago, but basically we have this emergency leave. If someone is unable to work due to COVID-19, not that they prefer not to, that they're unable to, then they're entitled to a job protected leave of absence. If there is a need for accommodations, for example, childcare, or if they have an immunocompromised medical condition that they can't go in public, they're entitled to accommodation. Again, need, not preference. Or if they're going to refuse unsafe work, and I'm going to talk about that more on the next slide. Those are the 3 exceptions. If the employee doesn't fall within one of those exceptions, they are required to return to work when they are directed to. And if they don't, it's effectively a resignation or an abandonment of their job. And we're working with a lot of our clients now to stick handle through this process. And basically, if they need the person back, then you've got to take a hard line. One thing I do say, though, to our clients is think about if you do need the worker back, because in most cases, our clients aren't ready to go back to work 100%. So if a certain proportion of their employees say they prefer not to come back, they're often quite happy with that. And we just want to make sure it's documented properly so the employee can't turn around later and say, well, they didn't bring me back or they wouldn't let me come back. So we can work through that as well. I mentioned safety in the workplace, and I'm going to talk about the right to refuse unsafe work. I'm not going to spend a lot of time talking about safety in the workplace. We've heard from a doctor, we've heard from Bill. They know a lot more about the medical side and the safety side than I do. But what's important to know from a legal perspective is that as an employer, you have a duty to take all reasonable steps to maintain a safe workplace, which of course includes trying to prevent the spread of the COVID-19 virus. As I believe Bill said, it's not one size fits all, but you're going to consider whether people can work remotely. If not, whether they can work but be physically distanced, or if they're going to have social interactions with colleagues, customers, suppliers, etc. The other question I do get a lot of is, can we insist upon testing, temperature testing or other types of testing? And that is a very dicey proposition. Obviously, we know a lot of companies are doing this. A lot of organizations are doing it. It is an invasion of someone's privacy. So anytime you're dealing with these questions, you're balancing the right to safety with the right to privacy. And that will be a very much a case-specific analysis. In some cases, like a hospital, it's a lot more compelling to say there's strong safety reasons. If it's more of an office, it may be less compelling. So there's always going to be that balance, and you're going to have to show a legitimate need, and that whatever method you're proposing is the least intrusive means possible. So every case will have to be decided based on its own particular circumstances. Just because you know someone who's doing temperature testing on their employees doesn't mean that you can. So I mentioned before the right to refuse unsafe work, which of course has always existed. Usually we talk about things like loose floorboards or harassment. Now we're talking about COVID. I think it's important to understand that this is not a concern about going out in public. It's not a concern about public transportation or carpooling, as Bill was talking about. This is someone saying that the workplace is unsafe. And as, actually, I'm not sure if it was Dr. Genesove or Bill said, but it's important. You need to have clear policies and clear procedure for how someone reports an unsafe workplace. If they do report that, then you as an employer have a duty to assess it and assess whether there isn't any legitimacy to the concern. And if so, of course, you're going to have to address that. Either way, you're going to have to respond to the employee. And if the employee is not satisfied with your response, their remedy is to go to the Ministry of Labor, who will assign an inspector. And I can tell you the ministry has already beefed up their resources. They've reached out to retired inspectors. They've transferred inspectors. They've already had thousands of claims. And I can tell you that very few of them have been upheld. In most cases, the ministry inspector has found that the workplace was safe. But this is the process that you would go through if someone refuses to work and says it's unsafe. But otherwise, again, they are expected to return to work. So I think this is probably my last point for now, and then we'll get to some questions soon. I am encouraging all of our clients to take some time now to debrief. Think about what's happened over the last 13 weeks. Think about how you could improve your legal situation going forward. So if you didn't have contracts which allow you to lay people off temporarily, and then you did lay people off, you took a risk. Best way to avoid that risk is having a contract with a temporary layoff clause. Our clients that have this were quite happy when we told them that you can do it without any concern. So make sure you have that. Make sure you have contracts with strong termination clauses, which will reduce your severance costs. And look at your policies. What didn't work over the last 13 weeks? Make sure your health and safety policies are up to date. Make sure your remote work policies are up to date. Your sick day policies and provisions are up to date. Anything else that didn't work over the last while, now is the time to fix it before, hopefully there won't be another pandemic for a long time, but before anything else should happen. So just in terms of keeping up to date, we have been running a running blog or a resource page, which I encourage you to follow. I mentioned the guide to getting back to business, which I'm happy to share with you. And generally speaking, we try to put a lot of information out there that hopefully is useful. So follow our social media, feel free to sign up for our newsletter. And most importantly, just feel free to reach out, even if it's just to ask me to put you on the newsletter mailing list, or if you have a quick question. If we can help you, that's great. If not, there's no harm done, but don't be scared to reach out. And that's all I'll say for now, but thanks again for having us be part of this, Brian.
It's our pleasure. That was a great presentation. All three were excellent. I feel like we could have given you each an hour, and we would still need more time. Quick shout out to the Vaughan Chamber team that are on here. I'm not going to name them all, but just thanks Jennifer, Theo, Adam, and the rest of you for everything you're doing to help put together all our programming. Okay, here's what we're going to do. I'm going to say the name of the person who's going to ask the question. And if you can ask your question, just say your name and concisely ask it. Just so I really want to go through rapid questions. There's a lot of nuance. You'll be able to follow up. Let's see how many we can get through. We're going to also proactively go to 11:10 for those who want to stay on. I know our speakers may have to go, so that's no problem. Just sign off when you need. So let's start with Jeanette. Jeanette had a question that I think would be appropriate for the doctor, Dr. Genesove. So Jeanette, You'd have to unmute.
Yes, I did. Hi, my question really was about in terms of people who have, sorry, I had actually so many questions. Just remind me of the one that you're focusing on.
Oh, okay. You had asked how many, just ask what you posted.
Oh, okay, sorry, about the COVID. Okay,
Okay.
I was already ahead onto something else.
No problem.
So the question is, what constitutes an outbreak? So if it's more than one case, we're really looking at where the critical point in shutdown is. So we run multiple business units in one facility. So if we had an outbreak, let's say in our on-site daycare, would that affect our fitness center? And where is the critical mass in terms of what constitutes an outbreak?
Well, let's see. Okay, I'm off mute. So, you know, so we're looking at clusters in workplaces, and as I mentioned, we're looking at 2 or more cases when there's transmission within the workplace. So really, for a situation you're describing and many other situations, it really depends on its own circumstances, right? So there's a few principles. So first of all, from York Region Public Health, the most important, there's 2 aspects that are really important. One is keeping everybody healthy and safe in the workplace, and ensuring that the workplace and the business are taking measures to protect staff so that they can stay open, right? So that's the main goal there. So there's no hard and fast numbers about what it is. You have to look at how many workers there are in a workplace. You know, if you have 2 cases in a workplace with 4 people in it, it's a whole different ballgame than 2 cases in a workplace with 500 people in it. And then you have to look at the protective measures that are implemented in the workplace. So, you know, we have at York Region Public Health, we have a health protection division that will do inspections in the workplace to look at what's being implemented. We also partner with the Ministry of Labor and refer cases to the Ministry of Labor. It'd be a little unusual for York Region Public Health to actually close the workplace, as we heard from Mr. Rudner, potentially for the Ministry of Labor also. But we referred cases of outbreaks to the Ministry of Labor also when there's issues about worker protection. And all the workplaces that we deal with, we try and connect them with Workplace Safety and Prevention Services and with Bill Chen so that they can utilize the services to improve the workplace. So there's no hard and fast numbers. You have to look at each individual workplace, how it's structured, what measures are in place, what the timing is, and what can be done to improve the workplace. And you know, most workplaces want to improve, want to keep their workforce safe and their consumers safe. So it depends on individual situation.
Thank you. Liliana, did you have a question? So what I think I'll do is, because we're going through, if the person doesn't answer right away, I'll just read it for what's listed. I think it's better though when you can ask your own question. So Liliana had asked, are there requirements for large employers with 1,000 plus employees? Why don't we go back to the doctor on that one, and we can go around if the other speakers want to answer that.
Well, so each workplace has to do a risk assessment. So I described the 4 pillars, the 4 public health principles that are necessary to include in business continuity plans. They apply to small businesses, medium businesses, and large businesses. Just a question of how they're implemented and to what extent. And we have, as I mentioned, we have our, on York Region's website, we have a business toolkit that you want to have a look at that give you guidance. And Workplace Safety and Prevention Services has their handbook also. So you have to look at that.
Bill, did you want to speak in, chime in on that, or Stuart?
As the law, Occupational Health and Safety Act says that as employers, they have the due diligence. They should take every precaution reasonable in the circumstances to protect the health and safety of their workers. So back to the situation of a workplace more than 1,000 people. So I think they should have some like policy, program, and procedure, and they should discuss with their joint health and safety committee. And if they have more issues, they can check our website or Public Health Ontario, or they can book a meeting with our account manager or consultant. We have more detailed information for them.
The only thing I would add to that, to what Dr. Genesove and Bill said, is you want to document everything you do. So as they've said very clearly, you need to have risk assessments, you need to put plans in place. But if you're ever questioned about what you did in the future, you want to have very clear documentation as to what you did to assess the risks, what you did to address those risks, and how those programs or policies were implemented. But other than that, I think Dr. Genesove and Bill have really covered it very well.
Thank you.
Okay, I thought James had a really good question. James, did you want to put that out there?
Yes, hi everyone. My main concerns is actually focused on the commercial restroom, and of course, you know, works in terms of the public restroom. So if you have a restaurant, or if you have a retirement home, or if you operate another business where you accommodate your customers through into your restroom, this area, so like restroom meaning the actual lavatory, okay, so the lavatory stalls, where it's probably the most infected room in your entire business, and has not been addressed, even by WHO has not even addressed that back in April in a report that they issued that was on the government website, and in terms of the protocol, right, of the steps going forward to reopen, they did not even address the actual restroom at all. So I found that a little alarming in consideration of the germs that you can contract through a lavatory, in terms of touching the toilet seat, in terms of touching the walls, et cetera, et cetera. So I'd just like to know if, in terms of the protocols going forward, is this going to be addressed? Because I haven't heard anything about it.
I can answer that one. It's Lori Shepard. I work with Bill.
Hi, Lori. Yeah.
You can hear me? Okay. In the post-pandemic playbook that Bill mentioned, there's a whole section on pathogen decontamination measures. So it talks about guidelines as far as cleaning activities, and there's even an example of a decontamination schedule that addresses things like washrooms. So areas that are touched a lot to our doors and handles, faucets, sinks, bathrooms. So it talks about making sure that you're using a product that is approved with a DIN number, Health Canada drug identification number. So this has to be, make sure you're using approved disinfectants, and again, make sure that you're following the manufacturer guidelines, that people are trained properly on how to use the product, that they've got the right PPE, and then following a schedule. In our example, it talks about at least 4 times per day spraying or wiping those commonly touched areas. There was a guideline that I read recently that talked about making sure that it's a good idea to keep your public washrooms separate from your employee washrooms. If you can keep staff separate from the general public. And again, it's like Bill said, you're taking every precaution reasonable, you're doing your best. So we have addressed this under Section 7 in the pandemic playbook.
Thanks, Laurie. Thanks, James. Belinda, did you want to ask your question?
I'm not going to ask the question. I'm just going to make a quick comment. I think for those of us that have kind of a community health kind of experience, there's some unique challenges. Just wanted to say York Region Public Health team has been doing a spectacular job. We're going to continue to consult you. We're also working with our provincial hospice partners around our policies. We will be doing screening, self-assessment screening, and temperature checks because of the population. I know from a labor issue, there's all those pieces. We're not forcing our staff or volunteers to get tested, but if they're symptomatic, are asking them not, they won't be permitted to come on premise, and we're just doing a slow and steady approach. It's kind of difficult because right now we are in York Region and we're in phase 1 still, we're not in phase 2, so educating our team and our staff, and also encouraging people to be self-accountable for their own self-checks and their own self-screening and how they're living their lives. People are worried. I'm really interested, Stuart, from a labor perspective, like, you know, we can't tell people like, you know, don't go socialize with your friends. And like, I have neighbors that are having full-on parties, right? And I'm like, just, we don't even take our dog out in front of the house anymore, right? So it's like, it's a concern, right? So the level of people's sense of risk. So I'm just, as as the leader of the organization, whatever that means, I'm just saying to people, be responsible, because the coworkers are kind of saying, I don't want to be in the building, even if we're like on separate floors, because that one's socializing, or you know what I mean? Or they're like, it's kind of tricky, right? And so if you have a quick comment on that front, I don't know if other people are feeling that. It's an interesting time, right?
Yeah, thanks, Belinda. It's a great issue, and I'll be quite honest with you. We have a summer student that just joined us this week, and she's looking for things she can write about and blog about. And we just talked about this yesterday afternoon. I think it's a critical issue because you're right. We're getting a lot of clients calling us saying we've had employees come to HR and say, I'm not comfortable working near so-and-so because I know they're getting together with friends.
Yeah.
They're not socially distancing. And it gets into this whole issue about how much can an employer delve into an employee's off-duty conduct, which generally speaking is their own business. We know that in some cases employers can impose discipline for off-duty conduct. Usually we talk about that in the context of stuff they do online and silly Twitter posts and things they do, and I love writing about those cases because there's never a shortage of them. But now we're talking about, did someone go out with friends last night, and can you ask about that? And I think it's important to remember that the purpose here is safety, and safety gets a lot of deference. And I wrote a book on just cause for dismissal, and I update it twice a year, which means I review every single just cause case. And every case that relates to discipline for safety breaches, judges are very deferential to that. So I think the same principle would apply, where if you can show that you are infringing upon someone's privacy for the purpose of maintaining workplace safety, you're going to get more latitude. What does that mean in terms of what you can actually do? We're still figuring that out, but I think it's, employers are going to have some right to inquire as to what people are doing if it could create a risk in the workplace. I think that's a really great question.
Yeah, well, they just kind of feel that they're discriminating against each other. Like someone says, oh, well, someone lives in a condo, right? It's like, okay, I live in a house. Someone might live in a condo, but it gets a bit much, right? So, I think for the health teams, like wash your hands, wear a mask. Like it's like just reinforcing good practice. So thanks, Brian, for giving me the opportunity.
No, it was a very, very valid question. Very valid question. I see Jeanette asked, can an employer demand an employee get tested? I know, Stuart, you did cover this at some level. Do you want to take this one again? And it looks like Bill's nodding his head too. So you guys want to talk about that?
Sure, I'll go first, and I'll be curious to hear what Bill has to say. But again, like I was saying before about temperature testing, I mean, anytime you're going to infringe upon someone's privacy, it's basically a battle of rights. On the one hand, they have a right and you have a duty to maintain a safe workplace. On the other hand, they have a right to privacy. So we are not advising our clients to do anything like this, to demand an employee gets tested, unless there's a legitimate reason. So it can't be a blanket asking everyone to be tested. But if someone is displaying symptoms, then we're typically telling our clients to send them home. But otherwise, if the person is challenging that and saying, I'm going to continue working, I think you would have a much more credible case for saying that the person should be tested first. But across the board testing or random testing or things like that, we're not recommending at this point.
Okay. You know what, Bill? I'm going to ask you guys this question. I was listening to the presentations earlier. We talk about you need to have a plan at the workplace for if someone is sick. Where do you get a sample of what that plan looks like, or can you talk about what a sample plan might look like? Like where do you get a sample? What should it include? Let's start with Stuart.
Oh, sorry. I was waiting to hear Bill's answer to that one.
Well, I don't know. Nobody's jumping up, so I'll just pick on you.
Fair enough. No, look, I think what I would say is we can help provide policies, but as far as the sample plans, that's really, I think, Bill more than us. And as I think everyone says, there is no one size fits all. So it really does depend on the nature of the workplace and the size of the workplace. But I suspect, and Bill, I don't want to throw you in the spotlight here, but I suspect you might have a better answer.
I think they can find some information from our checklist and those sector-specific health and safety guidance documents, and also some information from our playbook. But if you say a plan in place or template, as far as you know, maybe the return to work program or procedure is the closest one. That's what I can say.
Okay.
Yeah, and I just wanted to add what Bill had to say. In the playbook, section 5 covers the returning to work protocol as well as the self-isolation protocol. So it's all outlined in that section of the playbook.
No, I appreciate that. Oh, I see you're putting it up. Okay. I feel like this is my my eye test, where I have to see if I can read this and as you go quickly. Okay, that's great. I know the doctor had to go, but I just want to sincerely thank him for his time. He did give us a heads up. He had a hard stop at 11. We'll go a few more minutes. This is a very practical question for those in retail and restaurants. I think this is directed at Stuart, but Bill, you might want to tackle it as well. Do I have to accept cash if I'm a retailer? Do I have to accept cash? Is it legal not to accept cash?
Yeah, and I will say that's certainly not my area of expertise as to whether you can refuse to. So I don't have any real insight on that one. I've heard that, I've actually heard people say it's not legal, but I suspect others on this call may know that better than I do. Again, it's in the name of safety, so there's going to be some latitude. But I've also heard some people say that can be discriminatory in effect because you may have some segments of the population that only have cash. So I would be concerned about doing that, and I'm not sure. And again, I'd love to hear what Bill has to say. I'm not sure that's a necessary action that you need to take in order to maintain safety.
Laurie, I think you have a customer asking you the same questions. Can you share with us?
Sure, I can share that. I've had this question several times. So basically, some stores have chosen not to accept cash and instead going to tap, right, debit and credit. And the question whether that's legal or not, basically, according to the Bank of Canada, it's up to the seller to determine the method of payment. So there are no laws out there that require you to accept cash. Basically, as Stuart mentioned, though, there could be some limitations on what, not everybody has a bank account. Not everybody has debit and credit cards. So you may be leaving some people out as far as whether they can make purchases from your store. So you need to consider that. Now, if you decide to accept cash, just understanding that the virus can live on surfaces. So it's just similar to handling other objects like handrails or hard surfaces. So we have to encourage our staff to make sure that they can wash their hands. If they're not able to get to soap and water, that's the best. But if you can have a sanitizing solution, making sure that you've got a minimum of 60% alcohol. So if you have the hand sanitizer right there for them to use. I've heard of some best practices where people will keep kind of the dirty money and the clean money. So they have their money clean. When they accept money from a customer, it goes into the dirty money area. It's zipped up in a Ziploc baggie and they deal with it at the end of the day. But they're constantly cleaning their hands between each transaction. But there's no laws that require business to take cash. I was actually at a store on the weekend and they had a big sign. So if you decide you're not going to accept cash, make sure either through your social media sites, signage. So I was in a big long lineup out at a local store, and there was somebody screening us and talking to us and checking us out. But there was one individual who realized, oh, you're not accepting cash, and he, very quietly went away then, right? So just make sure you're very clear about your policies ahead of time, and if you are going to accept it, wash your hands.
Thanks a lot, Laurie, for that. And I think that's a really good point about being clear, because right now that's a big part of it, is just let's not aggravate people. They want to come shop at your store. Let's try and help them to do so in a safe and responsible way. Speaking of which, one of the questions we had was, what if I cannot afford to put controls in place for my workplace just due to the cost prohibitive nature of having to put in plexiglass? What is required legally, Bill?
You mean PPEs?
Well, yeah, like, and of course, this question for Stuart also. So if a retailer, let's say it's a small business, and they're just saying, I can't afford to bring in the cost infrastructure required to make these upgrades, I am allowed to reopen. I do have curbside pickup. Like, what are the guidelines for these businesses?
Okay, so here I want to share something. Let me see. Okay, here, as we know that actually PPE is not the best control measures for the risks, and for most workplaces, we always recommend, like here you see, practicing physical distancing, stay at least 2 meters from each other, and clean the surface and objects, and prevent contact. And also, so they are all the best practices. And for PPE, they are the least effective control measure, and they are always the last lines of defense. And also for PPEs, the use of PPE has sometimes has limitations. And as employer, you need to train your workers on how to properly use and clean and dispose of those PPEs.
Yeah, I'll just add to that. I think that there is this common view out there that, there's a requirement for PPE. And as Bill said, it's kind of like the least preferred option. The ideal is social distancing or isolation, in other words, working from home. If
and
not,
hand sanitizing, hand hygiene.
Hand hygiene and social distancing. But I've had this situation a few times now where people have refused to go back to work unless they're provided with specific PPE. And they don't have that right. Employees can't dictate terms like that. Now, as I said before, employers have to take all reasonable steps to maintain a safe workplace. But unless it's deemed to be essential that they provide that particular piece of equipment, an employee can't insist that, they're not going to come back unless you give me a mask or whatever the case may be. So again, PPE is not always required. There's lots of other ways to maintain a safe workplace.
Thanks, guys. Listen, we're going to have to wrap up shortly. I'm going to let one last question in from Jason, if Jason's still here, because I think that's a great question in the chat. Okay, so I'm going to, yeah, Jason, did you want to ask that?
Sure. I was just adding to the testing your employees. I've seen some companies offering to test customers, and I think there's a big grocery chain store. They're testing all their employees' temperature, and it's optional for the customers. Now, can businesses make it mandatory to test the customer? Like, how would that work?
This question came up a little earlier. I think Stuart pretty much addressed it. So depending on the nature of your business, it may be reasonable to conduct health screening measures that might include temperature checks. However, human rights, the occupational health and safety, and the privacy considerations need to be talked about and investigated before imposing these measures. If you decide to take temperatures, you have to understand what normal temperature range is, what constitutes a fever. All these things need to be thought about before you implement this assessment. And this is where we strongly recommend seeking legal counsel before you make this one of your policies. So lots of things to consider when it comes to taking temperatures, whether they're your employees or your customers. So look into it and think about the privacy considerations and legal counsel.
I'm not sure I could have said that any better, Lori, so thank you. I mean, I would say there is a very big difference, though, between testing employees and testing customers. And employees, generally speaking, have a right to return to work. Customers, I mean, for most cases, businesses can refuse to serve a customer as long as it's not based upon human rights. So you may have more leeway there, but you also just may lose a lot of customers if you refuse. So legal advice, but also think about the practicality. And as somebody said in the chat, I mean, the weakness with the temperature testing is it captures a moment in time. And if someone is taking medication, they may have the virus, but not have a temperature. So it's certainly far from perfect.
All right, thanks, guys. Bill, Stuart, Lori, we already thanked the doctor, but I really want to sincerely thank you for taking all our questions and providing those presentations. Any amount of clarity we're able to provide and comfort to business community, on how to reopen safely for employees and customers, I think is very valuable. We'll continue to do these sessions. I wanted to, for those who don't know, on next Tuesday, the Vaughan Chamber will be conducting a session with Isabella Bartani. She's an accountant that chairs our women's committee. She'll be doing an interview with Dr. Talia Zenlia on women's health. The conversation is really targeted towards women, but men are certainly welcome. So that's available on our website if you want to join that. Next Friday, I believe we'll return to a regular Zoom networking where we do, it's like speed networking. People have really loved it. I see a lot of deals happening there. I know we talked about it at Enzo right at the beginning for those who were on here early. So I'd encourage you to join and keep checking our website for resources from all sectors and supports, including from people like Stuart, who's posted a series of articles about employment law. And I'm sure, Stuart, I got more questions for you now than I did before the session. So thanks again, everyone, and I hope you have a great rest of the day and a relaxing, safe weekend. Thank you.
Great. Thanks, guys. Thanks to the whole team at the Chamber. And
thank you very much.
Stay safe, everyone.